Hello, welcome to the One Health Lens podcast. I'm your host, Dr. Diana Wangari Gitau. Today we're having a conversation about something we don't really think about until it becomes a problem. That's our eyesight. Because most people will go about their day-to-day life and then one day they're saying, I can't concentrate. Yet, it's maybe their eyes. And your eyesight affects not only how you learn, it's how you work. It involves all the way to road safety. And today in studio with us, we have very important guests. I'll let them introduce themselves and we'll get going. Daktari?
Hello, my name is Dr. Monicah Bituk, an ophthalmologist and the acting head of Eye Health at the Ministry of Health.
Daktari Wamacho at the Ministry of Health.
Yes.
Alex?
Yeah, my name is Alex Kaluyu. I am the head of education and rehabilitation at the Kenya Society for the Blind, and I'm also a service user.
Absolutely. We'll be hearing your story quite soon. I think, Daktari, I want to first start off by what many people would say Daktari Wamacho, yet there's a difference between an ophthalmologist and an optician. What's the difference?
Yeah, those two terms are very frequently confused. So an ophthalmologist is a doctor, has undergone medical training, then done a master's in ophthalmology. So they're able to provide generally most of the eye care services from surgery, treating different eye conditions, and even offering refractive error services, whereas an optician generally involved in providing glasses, like if someone can't see well, so they are generally involved in offering refractive error services or simply put, offering glasses for those who may not be able to see well. Yeah.
So maybe the person who gave me these glasses, optician, but I had eye surgery a few years ago, that would be the ophthalmologist, right?
Yeah. So most of the time they work hand in hand, so the ophthalmologist would review you, and if they find that your vision is reduced, then they can refer you for what you call a refraction or assessment of your eyes to see what power you need. Then the glasses are issued, or even contact lenses if needed. Yeah.
Okay, so they work hand in hand. But how big is the problem? Poor vision generally, how big is the problem?
Actually, poor vision due to refractive errors or due to not being able to see well, being short-sighted, long-sighted, is quite a common problem. It's the leading cause of visual impairment. And at the moment, of all people who have visual impairment who need glasses, we are only accessing 6.7%. So out of every 100 people who need glasses, we are only reaching less than 7. And if you look at that 7, it's mainly people who are working, people who can afford glasses. So there are so many people who are out there who need glasses but are not able to access, either due to costs or even just availability, or even lack of awareness and myths around wearing glasses.
And we're going to come to those myths. But Alex, I want to hear, what's your story, right? Because you said your title, but you also said you're a service, right?
Sure.
What's your story?
Well, issues of refractive error and what we would also call the also element of low vision is quite a big issue, especially for children who are growing up throughout the education system, even at the workstation. And until the case is identified, it is a big challenge, because in the classroom, a child will not be able to see the blackboard. And there is the teacher who may not be aware that this child cannot see and cannot see well. And the teacher is there using the normal methodologies of teaching, where if it's mathematics, they say this plus this is equals to this, then you divide by that. And this child who cannot see is left behind. And many of the people tend to think that that child is a poor performer, only that they do not have the confidence to face the teacher and say, teacher, I'm not able to follow because I'm not able to see. And for one reason or another, they think, and somebody thinks that that is the way every other person sees what they can see, because it is what I see. It's what I've been seeing all throughout my life. So everybody sees like that. If I'm not able to see the blackboard, everybody is not seen. So until that issue is identified, and then the child is identified, and then it's managed through either refraction and they are given glasses, then they are able to see either normal, or they are declared to be persons with low vision who can also see with the best correction, the best of the correction. So that is the biggest challenge for children. Then when it comes to adulthood, you've out of education system, you are going through maybe searching for a job, or you've gotten a job. Many people, that is one of the most misunderstood cases, because somebody will see they are beckoning you maybe from a certain distance, and you're not seeing them. Maybe your boss is beckoning you and giving you signs to come, and you're not seeing, and you're looking at him and he's thinking, this guy is ignoring me. Somebody is likely to be punished. Then if you're also not provided with the tools that will make you perform, there are certain errors that you will make out of, not because you really wanted to make the errors, but you cannot really see that you have a problem, that you cannot see the detail and that kind of thing. And I will say, and allow me to say this at this point, that today technology has been a game changer in managing issues of refractive error, issues of low vision, and issues of, because, everybody sees their own thing. It's about how much can I see, what can I see? And people will say, we are discriminatory. We see what we want to see and refuse to see what we don't want to see. That's not the case. It's the condition. It's personalized. The spectrum is as wide as the individuals. So technology comes to equalize the ground in a way that if you're using a computer or a gadget, it has those accessibility features where you can magnify the screen, you can change the screen colors, you can even magnify the screen negative. That is, you make it even the smallest according to your ability that you're able to see, because everybody has their way. You can't have one best way of managing refraction. You can't, refractive error, or managing low vision. It has to be individualized. And that's why you see when it comes to refraction, the ophthalmologist will say, how much can you see? So they give you glasses of the same power. If it's a magnifier, the same case. But when it comes to maybe gadgets, the mobile gadgets, the computers, you can have all those solutions in one.
And I know Dr. will showcase with the chart maybe the different, as Alex mentioned, it's a spectrum, right? But high level, maybe could you highlight for anyone who would be watching and listening, what does that spectrum look like, right? I'll tell you, I know I'm short-sighted, right? But what is that spectrum?
Yeah, so we have a range of refractive errors. Number one being being short-sighted, which I think is a term that is commonly used. We also have those who are long-sighted. And then we have a condition we call presbyopia, or difficulties reading as someone grows older. So you will see often people above 40 years, when they are reading a message, they have to push their phone further to be able to see.
With a larger font as well.
Yes, yeah. So that is called presbyopia. It comes with age. But you might find that they don't have any other issues, just the reading, and that is corrected using reading glasses. And I'm sure you've seen people who they wear glasses when they are reading. When they want to look at you, they
bring it down, or I put it up.
Yes, exactly. Yeah. Then for those who are short-sighted, then they are given glasses to correct that, or contact lenses. The same for those who are long-sighted, who are able to see distant objects very clearly, but when it comes to reading near objects, looking at things that are near, they struggle to see that. And this one is different from presbyopia. Presbyopia comes with age, but this other one can affect anyone at any time in their life. Yeah.
What are some of the myths you've had, right? You highlighted some of the challenges and myths, misconceptions. What are some of the myths you've had?
Yeah, there are so many myths. One of them is that if you wear glasses, your eyes sink or they become smaller.
But I think anyway, carry on.
Yeah, that when you wear glasses, they make your eyes weaker. Or your eyes weaker and become weaker, and you can end up being blind. So there are so many myths which are out there, but I just want to say, especially for children, when a child is in class and is struggling to read, the way Alex said, and you deny them that chance to wear glasses because of those myths and misconceptions, then you are denying them an opportunity to perform optimally in class. Yeah. So if they are assessed and they are found to need glasses, I just want to encourage parents to allow their children to wear the glasses so that they can perform optimally in school and they have a bright future. because poor performance sometimes leads to a poor future, so to say. Yeah.
Very much so. And I think
to the myth, I also add something.
yeah, please do. And I was going to come to you and say, even as we wind up, right?
Yeah.
Because it's also what solutions exist out there. Because sometimes maybe access is a problem, cost is a problem. What beyond technology, what else is happening?
Yeah, that ties with the myths because there's an assumption that if you have refractive error or you can't see well, you are blind. And so most of the time we tend to ignore, and parents tend to ignore. When you're walking and knocking things down, you tend to be like, they quarrel you because they say, why can't you see, and that kind of thing. So and if you can't perform in class, they think that this is either a slow learner or somebody is not able to understand what is happening. Those misconceptions and misunderstandings, which can actually be solved by a simple pair of glasses. If you're given a pair of glasses, you're able to solve most of those things. If you are provided with the right technological gadget, assistive technology gadgets, then you are good to go. But the most important intervention would be, because the most important person here are the parents and the teachers. For early identification, then the parents will of course they will take the kid to the ophthalmologist or to the optician or whoever for refraction, and then they get the glasses. Those are two very, very important persons in this process. They identify the case, and then they taken, the children or the individuals are taken for refraction, and their cases are solved. Then in terms of an accommodating environment, because you need to make the environment more inclusive, whether at school or at work level. Like for example, when you walk around the town and you see those glass doors, very clean and very well polished, and nothing is marked. You've seen people walking into them. It's even worse when it comes to somebody who has a refractive error or even low vision. If you don't put that band that crosses and say this side of the door is closed, and this side of the door, which does not have the band, is open, somebody will just walk into the glass and they could hurt themselves. When it comes to lighting, you could go to some places that are very lit. It's good that you have just adequate light that can accommodate anybody who is fully sighted and anybody who has eye issues. And sometimes when the light is also too bright for certain people, you've seen people who are photophobic. When it's too bright, they'll be like squeezing their eyes or even straining to see, because when the light is directly into my eye, I'm not able to see what is beyond the light. So those are some of the interventions that can be undertaken. But the key thing, I repeat, technology is the game changer. We've even seen spectacles or glasses that have come in. They're called bifocal, daktari. The ones that you can use for both reading and moving around. You don't have to have two pairs of lenses. And we even have others that are even changing without even, you wouldn't even know when you start reading. You're able to read comfortably when you're moving around without having really that divided glass that you have to really move your head up and to accommodate the level of the glass that you want, whether it's the reading part or the moving around part. So those are some of the interventions.
Thank you. Daktari, any final word, especially you sitting at the Ministry of Health, any final word in terms of maybe policy shift? Because I'm hearing from Alex a lot of even workplace initiatives, right? Is there any final word you'd want either Kenyans to know, right? A parent to know or a child to know?
Before I put in the final word, allow me to mention, when we started, you talked about opticians and ophthalmologists. I also want to mention optometrists, who are also a very important cadre when it comes to refractive error services, they're able to offer, to assess and see if someone needs glasses, if they need contact lenses, or any other further intervention. So the assessment would be more comprehensive than what an optician would do. And it's a cadre that we have in the country, and they play a very key role. But as I wind up, I just want to urge parents if they see their children performing poorly in school, even teachers, one of the most important things for that child is to just check their vision, because it could be a visual problem that can be corrected by a simple pair of glasses. I also want to urge the adult population, as we grow older, it's good to get our eyes checked, especially for those who are above 40 years. It's good to have an eye check at least annually, because there are so many problems that can be found early before they progress and they become complicated. Not just the glasses issue, it could be many other issues that can be sorted out early. So just encouraging Kenyans to have their eyes checked, and eye care services are available in all county referral hospitals in all the 47 counties, as well as a number of private hospitals in the country. Thank you.
Thank you so much, Dr. Monicah. Alex, last word?
Well, let's not be embarrassed about our inability to see well due to refraction. Some of these conditions are correctable, so let's have our eyes checked at the nearest facility. And at the same time, parents, try to have your children checked even before they join school, so that any eye issues can be early identified and the children can be placed accordingly, and you can be advised, or even the refraction can be corrected.
Thank you so much, and thank you for joining me on studio. I think we'll continue talking about this, because out of 100 people with poor vision, only 7 are caught. I'm your host, Dr. Diana Wangari, and thank you for joining us on the One Health Lens podcast.